grip can only be performed on infants who aren't walking. Once the child is walking, we then need to look at other alternatives. We must check the minimum levels with the laboratory, explain the procedure to the patient, to the parent and guardian, and make sure the patient's foot is nice and warm. If it's not warm, you will not get much blood, so it's really important to warm the foot prior to collection. It's done by either putting the baby's foot under some warm running water. You can also put some warm water in a kidney dish, and we're done to check the temperature of the water to make sure it's not too hot. You need to assemble all of your equipment. It's best to put this in a kidney dish so it's all close. To position the patient, my advice would be to put the patient either on the bed or in mum's arms, because you may be in this position for up to 10 to 15 minutes. This is quite a drawn out procedure sometimes, so it can take quite a long time. You need to get yourself in a comfortable position where you're not going to strain your back. Site selection during this procedure is really important. It's best to choose the two shaded areas shown on the diagram, and this is because access to the capillary beds is best in this position. We never ever use the middle of the foot, because the lancet may actually puncture some bone, which may introduce an infection into the child, which we never want to do. So these two, either side of the heel, are the best site selections for this particular procedure. Only use the lancet with a puncture length of no greater than 3 millimeters. This will allow us to gain access down into the capillary bed. If you go any deeper, you could be hitting nerves and other tissue, which we don't want to get. It's also really important to remember not to use a previous puncture site. Never puncture outside the shaded areas because it may enter the bone. Never collect from a swollen or edematous limb. Don't hold the infant's toes back when you're performing the procedure. Don't put pressure on the ball of the foot, and only use paediatric devices which are approved. Never use a blade or a sim plate. There are a few different methods used to perform a heel prick collection. I'll demonstrate a couple. There's one called the tennis racket style, where you put your thumb under the heel and you use your forefinger to just in a milking action. That is one way you can do it. Another way is to simply put your two fingers underneath and use your thumb to provide the milking action. It's really important not to bend the baby's foot back. You don't want to put pressure. You don't want to stretch or strain any ligaments, so it's really important not to pull the foot back. And it's not a constant squeezing action. It shouldn't actually be hurting the baby, it's just a gentle milking action. You watch your capillary fill and you give it a squeeze. You release, which allows the blood flow to come back to the heel, and you squeeze again. You need to have a firm grip, don't put too much pressure on the actual heel, otherwise you will restrict blood flow. After we've gained consent from the parents, we've warmed the baby's foot, we've assembled all of our equipment, and we've positioned the patient in the site with some alcohol and allow that to air dry. Place the lancet against the selected site, so whichever foot you choose to do, and press it. Do not press too hard. Wipe the first few drops of blood away because these contain tissue and fibrin, which we don't want in our sample. You then apply a thin smear of Vaseline. EDTA goes first. It is a whole blood collection and we must not have any clots in the sample. SST goes second because this sample must clot. Why do we never collect a citrate tube from a heel prick? The body's response to a cut is to stop the bleeding. It does this by sending clotting substances down to the site. Citrate tubes are used for the investigation of clotting disorders. The response by the body to try and inhibit the bleeding will cause the results to be incorrect. We must collect all citrate samples via a feed. Has been informed the mother and warm the foot. We can now move on to performing our procedure. We need to alcohol the foot and allow it to air dry. We then need to prepare our lancet, twist and pull. Select the appropriate site, place the lancet up against the baby's foot and depress. Wipe the first few drops of blood away. Apply a thin smear of Vaseline. now we can begin collecting. So we squeeze, catch the blood drop and release. Squeeze, catch the blood drop and release. Squeeze. You continue collecting until you reach the fill line on the tube. We then remove the collection scoop and apply the lid. This will ensure no blood leaks during transport. Give the tube an invert. We're then going to rest it for 15 to 30 minutes to allow it to clot, then put it into the centrifuge and spin it down. We treat the microtainers as we would any normal large size tube. When using an EDTA, we must use 2 tubes. We must fill the first tube to 250 microliters, start on the next tube and fill that one to 250, and we get them to invert that one as well. This is to prevent any microclots from forming. To try and collect half a mil straight away without inverting, clots will be present in the sample. Squeeze and catch the drop. Squeeze and catch the drop. Once we get to 250, we'll give it to our assistant to invert. And start on our next tube. Squeeze. Once our second tube is at 250, we get our assistant to invert this tube as well. Continue with the same action until you reach 500. Put the lid on, get the assistant to invert, and receive the second tube. Squeeze. Squeeze. Once the second tube is up to 500, put the lid on and invert whilst holding pressure against baby's foot. Now that we have collected enough blood, we need to bandage baby's foot. So apply pressure to the site and gently apply a gauze bandage. This is to make sure adequate pressure is being held and there'll be no bruising to the baby's foot. Instruct the mother to leave this on for 20 minutes or until they get home and remove. Because these tubes don't have labels, we need to create our own label. You need to label each tube with the patient's surname, first name, date of birth, lab number, time and date of collection. Stick the labels that we make to the tube so the lab has all the essential identification. Once we have written on the labels, we then need to apply them to the tube. Once we have labelled all the tubes, we need to then band them together using a rubber band and transport them to the laboratory in an MSU jar. This is also need to label the MSU jar with the patient's surname, first name, date of birth, time and date, and a lab number as well.